Hey everyone, I'm Chalen Jackson.
I'm Benjamin Laves
with Senior Marketing Specialist, and we wanted to talk real quick today about the Medicaid unwinding that's going on starting April 1st and a few of the things that as an agent you should be aware of. So wanted to start off by just saying, obviously Medicaid unwinding starting very soon. Some of your clients may have already gotten letters about their redetermination process. And when I say some, we're talking about how many, Benjamin?
Well, we're getting from some of the main name carriers that we're working with, somewhere between 20 and 40,000 people are looking to be affected on this Medicaid and Medicare eligibility that are being affected by this Medicaid redetermination. So somewhere between 20 and 40,000.
Yeah. So that's in stark contrast with the numbers you may have seen in the news. Around 15 million people expected to lose or have altered eligibility for Medicaid. The population that is both Medicare and Medicaid eligible is a much smaller chunk of that pie. The largest chunk are people in non-expansion states and others that may have gotten Medicaid because of job loss or due to an income change that may now not be eligible because they have regained employment or had some other change in circumstances. They'll all be going through that redetermination process, but the portion that are Medicare eligible also, your DSNP clients, is going to be a much smaller percentage of this pool.
So seeing in kind of some of these instances, Chalen, when we are, yes, this is still a smaller number than the numbers we may have seen previously, but still a good chunk of people that are going to be affected by this. What's kind of that one call to action that an agent, like maybe someone tuning in, could offer their client moving forward? What's kind of that first step for them?
Absolutely. Two biggest things, especially for your DSNP clients. One, make sure addresses are updated. A lot of folks may have moved at some point in the past 3 years. Even if you have a good address for them for their plan, make sure they've updated that address with their State Department of Health and Senior Services or whatever it is in your area. That way, when those redetermination letters go out, they're going to the right place. It's going to be critical that they provide as much information as possible to ensure that they can be redetermined accurately and effectively, and there's no delays or loss of coverage if it can be avoided.
Sorry, I don't mean to cut you off. So they should be having, once they've updated those addresses or whatnot, what can they anticipate to see in the mail? I know we've talked a bit, government likes to speak in color coding or whatnot. What could they be on the lookout for that?
Sure, absolutely. So there's a couple of things that may happen. One, their state is going to send them a redetermination notice, and that's going to be based on your particular state schedule. I recommend reaching out to, in Missouri, it's going to be Department of Health and Senior Services. In your state, it may be named a different agency, but whatever agency in your state handles that, they've all got their own timelines. Most states seem to be going kind of back into their old habits. Every month they will do redeterminations on that group of people that originally gained eligibility in that month. So they're going to be running through basically a 12th of the list at a time between now and next May.
Is it safe to assume we're kind of just picking up where things left off in 2019?
In the vast majority of states, that's exactly what's going to happen.
Cool.
The challenge, of course, is you've got staff that may have never processed a redetermination before. We haven't done those in 3 years. We've got clients who may have become eligible for the first time in 2020 or 2021 that have never gone through a redetermination process. There's a lot of new territory for a lot of beneficiaries and even the staffers at your state agencies. So unfortunately, I'd say we can probably expect a little bit of confusion, a little bit of chaos, but once those redeterminations start getting processed, people will get notifications both from their state agencies and federal agencies as applicable. For example, if they lose their deemed status, they can expect those letters from Medicare talking about loss of eligibility for their DSNP plan from the carrier or loss of QMB or extra help as it applies to them.
And you talk about extra help a little bit here. To what I'm understanding, a lot of over this public health emergency, we saw kind of not as much concern or kind of waiving of spend down payments.
Sure.
What's that going to look like moving forward with these changes, and what's the billing? A lot of people are going to be affected. This is income level. This is, costing to these people. What can they anticipate moving forward?
So there could be a lot of changes. Here in Missouri, for example, we typically have that monthly spend down requirement for Medicaid eligibility for those that make just over the income and asset threshold. And what we may see, we don't know for sure, is those spend downs picking back up even before someone goes through the redetermination process.
Oh, wow.
So that's going to be possible depending on how your particular state is handling it. Every state has a little different schedule of how often they recalculate or reapply spend down requirements. So depending on how they're handling redeterminations and their normal timeline for spend down analysis, your client could be facing copays again much sooner than they anticipate, even if they have not gone through the redetermination process.
Interesting. So even before they may see a change in their specific level, they may be required to start owing or start paying those either spend downs or copays that they haven't been used to paying previously.
Correct. Yeah.
Interesting.
So we absolutely could see some of that. In addition, that's one of the big things to look at. If you have someone who does have a change in status, and again, the first folks may see that change in status as early as next month, we need to make sure that their billing information is updated with their carrier. So for your DSNP eligible members, if they are getting those letters saying, hey, you're no longer going to be eligible for this plan, in most cases, they're actually going to be able to stay on that plan up to 6 months, but they are going to be subject to premiums, to copays, to deductibles, to other cost sharing. And if when you first set them up on that plan, you selected send me a paper bill because you didn't anticipate them ever paying a premium, since they were dual eligible, now's the time to maybe re-examine that, make sure that they're set up for Social Security or bank draft or whatever makes the most sense for that client. But we don't want them to miss that paper bill in the mail if one comes. We don't want them to lose their plan in that way.
So really, taking this time, it's, we may not see a lot of, maybe we will see a lot of changes. These clients are going to see some changes, but now is a really good time just to check in with these clients, make sure you kind of do that spring cleaning, I guess, if you will, making sure their addresses are up to date, not only with their carriers, but with the state Medicaid offices, as you were mentioning earlier, and really take a look at, hey, if or when this happens, we kind of have a plan in place for it.
Absolutely. And I think that clarity of conversation, that kind of advance notice that you can provide as an agent is going to be critical, not to just to making sure your clients know what's going on and feel comfortable with the process, but also in your retention. Because unfortunately, something that is more likely than ever is that this huge amount of change, lots of letters that they're not used to, lots of people reaching out, depending on how your state handles the redetermination process. It's also going to make a lot of these folks losing Medicaid eligibility ripe for the picking for scammers. Unfortunately, it's going to present, anytime there's some kind of chaos in the market, it's going to present a huge opportunity for scammers to reach out and try to, bamboozle them into something that they don't need or something they don't want. All your traditional scams surrounding wire fraud and things like that, but also even enrolling someone in a plan that's not a good fit for them based on something that hasn't happened yet or may not happen at all.
Interesting. Yeah, I know even in the forefront of COVID, we saw a lot of an increase in those phone calls coming through, all these mails coming through, and it sounds like that's not really going to change. It's just the why behind they are able to reach out to your clients. So making sure you're having those touch points with your clients is extremely beneficial, not only for retention, like you mentioned earlier, but also in protecting your client moving forward. Absolutely. Make sure they are their first wall of defense, and making sure that they're prepped and ready for that. Especially in an unknowing and kind of confusing time like we are about to enter into.
Well, and I think there's a couple other considerations as well, not just protecting those clients, but as we continue to see new clients and look at someone who may be coming eligible for Medicaid for the first time in the near future due to this redetermination process and something that we haven't been going through in the past 3 years, it's entirely likely that in some states you may see increased processing times for new Medicaid applications, which can result in delays in accessibility to coverage and maybe mid-year changes that we weren't anticipating. So it's going to be more important than ever to help walk those clients through what that process is going to look like and what they can expect going forward as their eligibilities do eventually get processed. I know here in Missouri, those processing times are something we were already struggling with once we expanded Medicaid eligibility. So seeing that coupled with all these new redeterminations could very well put us even further behind. I know the state and most states are planning for that increased workload with some additional hiring and training and things like that. So I don't expect major disruptions by any means, but things definitely may take a little bit longer. And especially for your underage clients, if you're working at all with the ACA, like we mentioned, we're talking 20 to 40,000 people on Medicare and Medicaid that are going to be affected. The rest of that 15 million number you keep seeing in the news is going to be folks that are potentially going to need an ACA plan, or people that are, they, like I said, they may have become reemployed but could not be disenrolled from Medicaid. They may already have a group plan again now. Maybe no action is going to be necessary for them, but a good chunk of these folks may now need an ACA plan, and it's going to present a huge opportunity to network and resource those folks into the plan that's going to fit their needs.
I think that's a really good thing that you bring up here. So I guess I want to take this one last second and kind of maybe outline the opportunity. Just after this here, you mentioned an increase in processing times, an increase in kind of the volume that they're going to be working through. If that eligibility verification is being delayed or anything, will that affect when they can apply, what that process looks like, or will we still be able to help them even through this delayed process?
Sure. So it may change what plans a client is eligible for. Okay. So if they're waiting on that Medicaid determination to say qualify for a D-SNP plan, we may run into situations, which are not at all uncommon, where we have to put them in, say, a standard MA plan, or depending on their situation, maybe even a Medicare supplement and a PDP, depending on their needs in specific case. That may be kind of a stopgap measure while we wait on that Medicaid to process. Gotcha. And of course, they'll have that opportunity to make that change when they become eligible for Medicaid. So a lot of it is going to be demonstrating flexibility for those clients. Gotcha. And making sure that even if we are kind of waiting on some paperwork, that you've got options to present. They're going to make sure that they maintain coverage, avoid any penalties or late fees, and can access care.
It's a lot of options, and it sounds like even more so some potential opportunity here as an agent as we go into this kind of unwavering time. What would be kind of the one opportunity that we should try to send some agents away with here today, that, with this happening starting April 1st, here's when we're going to start seeing some of these redeterminations go into effect. What can an agent be doing? What's that takeaway?
Right now today, go through your CRM, pull all of your dual eligible clients, look through anyone that you terminated an ACA plan for in the past couple years because they became eligible for Medicaid. It's a great time to start proactive outreach to those clients and say, hey, here's what you can expect. It may not even be happening until early next year, because again, agencies have 12 months to complete this. Yeah. But getting folks on the right page of making sure addresses are updated, it's just that great extra touch point with some really vital information to make sure that you're serving them to the best of your ability, and that they're prepared no matter how that redetermination process looks for them.
Man, a lot of change coming, and obviously, agents like yourself are hearing about it. So hopefully this video was a bit more beneficial to you to kind of clarify some of those gray areas. We live in an industry that is gray, but apparently there's different shades of them. So we'll take a look, and hopefully this was beneficial for you all. So.
Yeah, absolutely. As with anything, if you've got any questions whatsoever about Medicaid unwinding, the process your clients may face, or what we can help you with, give us a call at Senior Marketing Specialists, 800-689-2800, or reach out to us online at smsteam.net. We'll talk to you all soon.
See ya.